The 6 diabetes symptoms you should understand before it's too late. Symptoms of type 2 diabetes could take several years to manifest. Some individuals exhibit no diabetic symptoms. Insulin's function is to regulate blood glucose, sugar, levels. Blood sugar must be carefully managed for the body to function normally. Overly high blood sugar levels can harm organs, blood vessels, and nerves. In addition to insulin, your body requires sugar to produce energy. In this video, I will discuss 6 warning signals to watch out for. Then, I will provide 6 additional tips for avoiding diabetes. 6 warning signs. 1. Frequent urination. In people with type 2 diabetes, the kidneys are unable to digest all of the glucose in the blood and excrete some of it in the urine. Intense polyuria, characterized by increased urine output, urination frequency, and urination urgency, develops as a result. Some people find that they need to get up and urinate every few hours during the night and that their urine output increases when they do. The kidneys attempt to filter out extra sugar from the blood when blood sugar levels are high. 2. Increased thirst. The frequent urine required to eliminate extra sugar from the bloodstream might cause the body to lose more water. This can lead to dehydration and make a person feel thirstier than usual over time. Dehydration happens when the body lacks the required amount of fluids to function effectively. Illness, extreme sweating, excessive urine production, vomiting, or diarrhea can induce dehydration. Diabetes mellitus, elevated blood sugar can cause excessive thirst, hyperglycemia. It is frequently one of the initial symptoms of this form of diabetes. This produces an imbalance and water loss in the body, which leads to increased urine and thirst. 3. Fatigue. Diabetes tiredness is caused by inadequate sugar transport from the bloodstream to the cells of the body. A healthy diet and frequent physical activity can aid in reducing weariness for many individuals. Those with type 2 diabetes who experience fatigue are not alone. Oftentimes, this disease is characterized by fatigue. There are numerous potential reasons, such as diabetes-related complications and underlying illnesses. In type 2 diabetes, insufficient blood sugar control often results in hyperglycemia or elevated blood sugar, which can induce fatigue, among other symptoms. However, hyperglycemia is not the main cause. Some individuals, particularly the elderly, become dehydrated because their blood sugar levels are so high, and this causes excessive urine. 4. Blurry vision. Vision impairment may become permanent over time. Blurred vision can occur if the ocular muscles have not yet adjusted to rapid changes in blood sugar, either from high to low or low to high. The eye's ability to focus depends on the lens, a membrane that is suspended by muscles and is highly malleable. The lens loses some of its bending capacity in a high-sugar environment, such as in uncontrolled type 2 diabetes, making the eye's focusing muscles work harder. If diabetes-related visual impairments are caught early, normal vision can be restored after about 6 weeks of healthy blood sugar levels. 5. Slow healing cuts and wounds. Consequently, even minor cuts and wounds may require weeks or months to heal. Additionally, slow wounds healing raises the danger of infection. This can impair the body's capacity to repair wounds. In persons with diabetes, wounds tend to heal more slowly and progress more rapidly, therefore it is essential to know what to watch for. Cuts, scrapes, scratches, and blisters can develop anywhere on the body, but the feet are one of the most frequently affected areas. A little foot wounds can rapidly develop into a foot ulcer. Untreated foot ulcers can become life-threatening. Approximately 15% of persons with diabetes develop foot ulcers. Therefore, it is essential to perform regular self-checks and thoroughly monitor any wounds. Early detection of wounds is the only method to limit the likelihood of complications. Before we get into the rest of the list, be sure to give us a thumbs up, subscribe to our channel, and ring that notification bell. 6. Tingling and numbness in your hands or feet, neuropathy. High blood sugar levels can negatively impact blood circulation and cause nerve damage. This can cause discomfort, tingling, or numbness in the hands and feet in individuals with type 2 diabetes. The term for this ailment is neuropathy. If diabetes is left untreated, it can progress over time and lead to more severe consequences. Long-term exposure to high blood sugar levels can damage neurons throughout the body. Some individuals may experience no symptoms, while others may experience numbness, tingling, or pain in the extremities. Although it is more common in those with diabetes who have had the disease for at least 25 years, it can also occur in those with prediabetes. 6 suggestions to help avoid diabetes. 1. Select carbohydrates wisely. Diabetes does not necessitate a total carbohydrate restriction. Select carbohydrates that are broken down slowly in the body and provide consistent energy. Choose whole grains, legumes, nuts, fresh fruits, and vegetables. Yes, you may consume fruit despite its sweetness. It involves consuming the appropriate amount of carbs at each meal. A licensed dietitian can help you determine your optimal portion size. However, all carbohydrate sources, not only sugar and refined carbs, promote insulin release. Although refined carbohydrates are processed more quickly than complex carbohydrates, there is inconclusive evidence linking a food's blood sugar increase to diabetes risk. 2. Physical activity and exercise. Do it for a half hour per day. If necessary, increase the time. Exercise can help reduce cardiovascular risks, cholesterol, and blood pressure, and maintain a healthy weight. In addition to relieving stress, exercise can help you reduce your diabetic prescription dosage. Regular physical activity may aid in the prevention of diabetes. People with prediabetes frequently exhibit insulin resistance, also known as insulin insensitivity. In this condition, the pancreas must produce more insulin to transport sugar from the blood into the cells. Exercise enhances the sensitivity of your cells to insulin, so you require less insulin to control your blood sugar levels. Multiple types of physical activity have been demonstrated to decrease insulin resistance and blood glucose levels in persons with prediabetes or type 2 diabetes. 3. Make an effort to lose excess weight. Exercise, nutrition, and weight loss programs dramatically lowered the incidence of type 2 diabetes by 40% to 50% compared to a control group, according to randomized, 2-year research involving more than 1,000 patients at high risk for the condition. There exist numerous healthy weight loss options. An excellent place to start is by preparing a balanced plate of non-starchy veggies, lean proteins, complex carbohydrates, and healthy fats. Losing weight is challenging and requires work. Making the environment in which you work both physically and socially conducive can help you succeed. 4. Reduce your serving sizes. Appropriate portion sizes may also aid in the prevention of diabetes. Eating an excessive amount of food at once has been demonstrated to increase blood sugar and insulin levels in individuals at risk for diabetes. In contrast, eating smaller quantities may lead to a reduction in caloric intake and weight loss, which may lessen the risk of diabetes. Although there are few studies on the effects of portion control on individuals with prediabetes, type 2 diabetes research provides insight. Following a meal plan with portion-controlled meal replacements and adequate portions of other healthy foods led to weight loss and a reduction in body fat, according to a study of persons overweight or obese, including some with type 2 diabetes. 5. Get adequate rest. Additionally, as you sleep, your brain processes your emotions. Your mind requires this time to recognize and respond appropriately. When you do so, you tend to have more negative emotional responses and fewer happy ones. Insomnia might also increase the likelihood of having a good condition. Rejuvenating sleep allows you to reset a poor day, enhance your view on life, and be better prepared to face obstacles. There may be long-term benefits to taking a brief break. 6. Schedule doctor visits. Expect to visit your physician 2 to 4 times annually. If you take insulin or require assistance managing your blood sugar, you may need to visit the doctor more frequently. Additionally, get an annual physical and eye test. Eye, nerve, and renal damage, in addition to other consequences, should be examined for. Visit the dentist twice annually. And be careful to inform all medical professionals that you have diabetes. Early identification and treatment of diabetes can significantly enhance a patient's quality of life and decrease the risk of developing potentially fatal complications. Maintaining a normal weight reduces your risk of developing type 2 diabetes. Eating correctly, watching portion sizes, and getting plenty of exercises daily will help you keep your weight in check. If you are interested in some healthy food choices, check out this video. The 15 low-calorie foods that will help you stay healthy all year round. Have a great day. Take care of yourself.